They have to be sensitive to us. They have to treat us with dignity. I think that, for me, is the number one. I don't want to be invisible, and I don't want them to treat me like I'm invisible.
We've got to first develop trust with the medical provider. Our community still has a great deal of suspicion about what medical providers are about. If they're drawing blood, we want to know why, and all of that's because of a whole history of distrust. So we have to develop trust.
Now, with my husband, he has issues from his past because he's from the South, and there was a lot of distrust with the medical profession. And so even though we're not down south, that attitude has kind of followed him here.
And then I think the last thing is that medical providers need to not be afraid that something is going to rub off on them from the members of our community, and be willing to touch, be willing to actually examine a patient before they reach conclusions.
I actually have been to a doctor. I was referred to someone, and he had to look at my skin, and I felt like he was afraid to touch me. I just felt like, oh, he's probably never seen a black person in his life, and it's coming out. And so I think if there were more people of color, or even doctors who were more sensitive to our needs, because I think some of our needs are different from those of other races. And to me, there needs to be some more training involved so that they're sensitive, so that they are compassionate, and we want them to validate how we feel and not discard how we feel.
Well, in our community, still the most trusted person is the pastor of a church. I've got a whole file of doctors who I recommend to people for different kinds of diseases and sicknesses that they have, because these are people who have a proven record that they can be trusted, that they're going to listen, that they're going to consider, that they don't mind touching the patients. People invite me to come and be a part of their surgical procedures. Some medical providers are open to that. Others will use HIPAA and other justifications for saying that it can't happen. And as a result, some patients never get the care they need because the person that they trust is not allowed in the room.